going to do a hand treatment today, and a lot of patients complain about the crepiness on the skin of the hand and the veiny appearance. So if we put some fillers in, and we can put Radiesse in there, we can kind of plump it out, okay, and make it look a lot more youthful. And what I like to do is actually I like to what we call vamp it up. Put some platelet-rich plasma, and that is how we do the vampire facelift on the face. We can do the similar thing on your hands. We could put a little PRP in there and help enhance the effect and build collagen so we can make it last longer. Okay, and this is how we vamp it up. Take a little blood. And we want to get those platelets. What I'm going to do first is just to numb up a little spot that is where we're going to go in. Okay. This is some lidocaine with a little epinephrine. So we are using Radiesse, and this is the Radiesse without lidocaine because we're going to mix. I like to mix my own lidocaine in with it. It comes with lidocaine mixed, but I'm going to mix it myself because I want it to be a little bit thinner for the hands. So it's in a package like this, and we're going to use two, one for each side. So here we have the lidocaine in one syringe, and we have about 2 cc or 0.2 cc's of lidocaine and one syringe of 1.5 cc Radiesse, and we're just going to mix it. Okay. So we are going to use a cannula to inject the Radiesse. That way we can just make one entry site. So this is a cannula, and this one's made by Softfill. And there's a needle here, that's a sharp needle that we're going to make the entry site with. And the longer needle here is actually a cannula because it's not sharp. We need to make the entry with the sharp needle, and then we're going to go in with the cannula. And this is a 23 gauge Softfill cannula. Yeah, pan around so you can see the difference. That's the side we just did. We just did this one, and we're about to do this side so you can see the difference. Okay. Now, this again is the cannula. It's blunt, so we made the hole previously. I'm just going to gently go under the skin, and we numb that area that we went in so it doesn't hurt. So that blunt cannula is under the skin now. We can just slowly advance it. Okay. So, and although the cannula is blunt, so we don't really have that much risk of injecting into a blood vessel, we want to be careful to do it very slowly, because if you put enough pressure you can poke through a blood vessel. And I like to advance it and then inject as I pull back a little bit. That also helps prevent putting the cannula into a blood vessel. But see, there's a natural space underneath that takes the product, so.
But it would just be a bruise that goes away. right? If it were to happen?
If we were to break a blood, if we were just to break a blood vessel, you would get a bruise. But what we don't want to do is actually cannulate a blood vessel, put the cannula in a blood vessel and inject it. That would be bad. But if you're careful and if you use a cannula, it's not likely to happen. Okay, so that's half of that syringe.
Hey, Shar, take my purse out too, because my phone's on. Just throw it in another room.
Get around the knuckles there. So it's just pushing that blood vessel aside, and I just went over it. Get around it a little bit. Then we just massage it. Spread around evenly. Your hands will swell for a few days.
I'm not going anywhere.
Okay. Now we did both sides. Okay. Yeah, so now we've injected the Radiesse, and this is the plasma, platelet-rich plasma. And this might throb a little bit.
I'll let you know.
This is the part where we vamp it up and give it that extra boost of collagen.
I don't feel a thing.
Okay. The lidocaine that we put in there kind of numbs it too, which is nice, because it can burn.
But I can use my hands, like I can just normal. Okay.
Mm-hmm. And this will make it swell a little bit.
Okay.
And basically we're putting that so there you have it. Their Radiesse hand rejuvenation with a little vampire
You calling me a vampire?
little vampire touch. And your hands will swell. You could put ice on it, okay? Don't take any aspirin.
No Tylenol or anything.
You can take Tylenol.
Okay.
This aspirin will interfere with the platelet action. And it could increase your chance of bruising, so.
That's remarkable.
I know.
There we have it.
Ta-da!
Hand rejuvenation. And what we can do is we can also do an IPL to clean up some of these sunspots on the hand. And when you come back for your follow-up in about a week, we'll take a look, and maybe at that time we'll do an IPL to clean up some of the spots on the back, the sun damage.
Super.